What's going on, world? Welcome. Hey, so today, you guys already know what the deal is. Today is Friday. We're doing NCLEX questions today. NCLEX questions. NCLEX questions both for RNs and LPNs. Got them off of nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. I know I'm a little late. It's 5:30 somewhere, just not in Texas, but hey, it's 5:30 somewhere, so I appreciate everybody being here. Of course, we ain't going nowhere unless I got 1,000 likes and 100 people up in here. So I'm gonna need for y'all to make haste so we can get that taken care of. But of course, if you guys are new here, my name is Kevin. I've been a nurse for 3.5 years. I worked OR, PACU, and ICU. Was in the Navy for 16 years. And hey, here we are. What's up, Nico? What's up? Sam? What's up? Hi. Your name is Swastika. Wow, that's a nice name. Shout out to you. Hey, how y'all doing? We're about to do NCLEX questions. I need for y'all to like, share, and follow. That's the trifecta to get stuff out. So I need to be on everybody's For You page, just like I was on your page, and that's how you found me. So, of course, I want to know who you are, where you're from, where you're at in your nursing journey. And of course, if you're not a nurse, what are you doing here hanging out with us? It says, please all share. Yeah, make sure. Let them know. Hello, how are you? Need 1,000 likes and we need 100 people up in here. So we're about halfway with the other stuff. So let's see what's going on. So we're going to do NCLEX questions. I'm going to be on here for about an hour. So we'll see how it goes. Make sure you guys participate because participation is the key. All right. Because, hey, if you guys don't participate, it's going to take longer. All right. And that's not what we want. Making an hour and a half. Nah, we ain't doing all that. Schedule my test since I was having palpitations. I bet an RN in Fiji, 6 year in nursing. Shout out to you. Hey, we got 100 plus people in here. I need 1,000 likes. I need all 100 of y'all to be smashing that like button. What's up, Dean? How are you? Make sure y'all keep smashing that like button. All right. Ladies and gentlemen, you guys already know the deal. We're going to be doing NCLEX questions. It ain't 5:30, but hey, it's 5:30 somewhere. So we're about to get this thing started. I'm going to put y'all on the timer. So here we go. Ladies and gentlemen, question number 1. A 28-year-old male has been found wandering around in a confusing pattern. The male is sweaty and pale. Which of the following tests is most likely to be performed first? Is it a blood sugar test, CT scan, blood cultures, or an ABG? What are we thinking? Rocio, your NCLEX is tomorrow. Then get off my live. Get off the live because this is considered cramming and there's no need for you to be here. So if you don't know it by now, you don't know it at all. But in reality, no shade, of course. You're prepared for it. You're good. You're just trying to curb that nervousness. So go and relax until it's time for you to take your exam tomorrow. All right. For everybody that's in here, make sure you guys keep smashing that like button. You guys share and you guys follow. Hey, I need at least 10,000 likes before we get to question 10. So I'm just saying, if I don't have it, I'll boycott the rest of this live. Try me if you want to. All right, here we go. Here's our answer in 3, 2, and oops. Just kidding. And the answer is A. It is blood sugar. With a history of diabetes, the first response should be to check blood sugar levels. That is part of reduction of risk potential, which is the 4th largest section on the NCLEX exam at 9 to 15%. All right. So shout out to y'all. Hey, remember, you guys need content, Q&A, rationales. If you got it wrong, go to the rationale and read it. All right, go to the rationale and read it. That's how you're able to retain the information. So shout out to all y'all who got that question right. Question number 2, a mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of potty training? The age of the child's ability to understand instructions, the overall mental and physical abilities of the child, or frequent attempts with positive reinforcement. What are we thinking? As you guys are joining, my name is Kevin. We are doing NCLEX questions both for RNs and LPNs. Got them off of nurseslabs.com. They are free sets of questions, so make sure you guys keep smashing that like button. You guys share and you guys follow. If you guys are in nursing school right now and haven't shared it to anybody, what are you really doing with your life? I'm going to need for you to fix yourself and share it to everybody. I need everybody to be friends with me. All right, y'all, here we go. Sharita, what's up? How are you? Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is C, the overall mental and physical ability of the child. Age is not the greatest factor in potty training. The overall mental and physical abilities of the child are the most important factor. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Smaller section, but definitely very much important of the 8 client needs section. So shout out to everybody that got that question right. All right, here we go. Question question. Number 3, a parent calls the pediatric clinic and is frantic about the bottle of cleaning fluid her child drank for 20 minutes. That's a long time to be drinking something. Which of the following is the most important instruction the nurse can give the parent? Is it A, this too shall pass? Okay. Is it B, take the child immediately to the ER, contact the poison control center quickly, or give the child syrup of Epicac? What are we thinking? What are we thinking? What is the most important? All right. Shout out to all 300 plus y'all. We're doing NCLEX questions. Make sure you guys keep smashing that like button. You guys share and you guys follow. So like it says, yeah, this too shall pass. It will. It'll pass. Somebody will. But if you guys are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. We are, obviously, it's A, right? Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is obviously not A, right? It is C. Contact the Poison Control Center quickly. The Poison Control Center will have the exact plan of action for this child. Anytime a child drinks anything that has chemicals or anything and they tell you to call CDC, they got it. A. They got you on standby. I'm just letting you know that's part of safety and infection control, which is a smaller section. I believe it's not 10 to 15%. 10 to 15% on the NCLEX exam. All right. So still a smaller section, but still very, very much important. So shout out to all y'all that got that question right. Here we go. Question number 4. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? Gluteus maximus, gluteus minimus, vastus lateralis, or vastus medialis? What are we thinking? You're in Texas. A shout out to everybody from Texas. I live in Texas, specifically in San Antonio. So shout out to y'all. Here we go. Here we go. Let's see what you got. We got some A's. We got some C's. A lot of people saying C. Cool. All right. Let me give you guys 10 more seconds. All right, here we go. Here we go. C. C seems to be the general consensus. But all right, here we go. Here's our answer in 3, 2. And the answer is C, vastus lateralis. Medications are injected into the bulkiest part of the vastus lateralis thigh muscle, which is the junction of the upper and middle thirds of this muscle. That's actually part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. You see other spots will say 14 to 18, whichever. It still doesn't take away the fact that it is the second largest section on the NCLEX exam. Know your pharmacology. Know how to do medical administration. That is part of pharmacology, all right? So shout out to y'all. Somebody said wash your hands. Always wash your hands, you nasties. Question number 5. A nurse has just started her rounds delivering medication. A new patient on her rounds is a 4-year-old boy who is nonverbal. This child does not have any identification on. What should the nurse do? Contact the provider, ask the child to write their name on paper, ask a coworker about the identification of the child, or ask the father who is in the room with the child's name. What are we thinking? Whoa, Mackenzie, you passed your NCLEX. Shout out to you. Hey, if y'all have never been here before, you come here, you pass your NCLEX, you tell me, I give you a shout out. Shout out to Mackenzie. Mackenzie, welcome to the greatest shit show on earth, known as being a nurse. Congratulations to you. If there's one piece of advice that you could give to everyone trying to conquer that NCLEX, ma'am, what would it be? And once again, congratulations to you. All right. And also, don't get it twisted. LPNs are nurses. All right. It says it in their name. All right. So y'all need to chill with your egos and everybody love everybody. All right. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D. Ask the father who is in the room the child's name. In this case, you can determine the name of the child by the father's statement. You should not withhold the medication from the child after identification. That is part of safety and infection control. 10 to 15% on the NCLEX, smaller section, but still very much important of the 8 client needs sections on the NCLEX. And remember, if you got it wrong, if you got the question wrong, you need to read your rationales. Right? When you read your rationales, you retain the information. Guess what? You're going right back to the beginning, doing content, then Q&A, then rationale. Same type of rotation. Ladies and gentlemen, I got some test taking tips for you guys. 42 pages of delicious buttery goodness with a man with a fanny pack. Stop playing games with me. You know what I'm saying? thebootnurse.com/test. You guys can go over there and check that out for yourself. It is a free download. Like I said, it's 42 pages. So shout out to all of y'all. Y'all make sure y'all go over there and check that out. Just past the NCLEX. Good luck, everybody. Shout out to you, Rose. Rose, congratulations to you. Welcome to the greatest shit show on earth. If there's a piece of advice you could give, what would it be, ma'am? What would that advice be? Here we go. Question number 6. Kate, by the way, I see you out there. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's lab results would expect which of the following changes in lab findings? Is it an elevated serum calcium? Is it a low serum parathyroid hormone, elevated serum vitamin D, or low urine calcium? What would it be? Shout out to everybody here that's rocking with me. Make sure you guys like, share, and follow. That is the trifecta to get on the For You page. If you're in nursing school and you haven't shared this with people you're in cahoots with, first of all, you're wrong. Second of all, fix yourself. Just saying. Make sure y'all make that happen. Got these off nurseslabs.com. They also have care plans over there for y'all that are in nursing school. So go over there and check them out. Okay. All right. Here's our answer. Here is our answer in 3, 2, and the answer is A, an elevated serum calcium. The parathyroid gland regulates the calcium level in the blood. In hyperparathyroidism, the serum calcium level will be elevated. The chronic excessive reabsorption of calcium from bones caused by excessive parathyroid hormone can result in osteopenia. All right, that is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. Okay, 9 to 15%. Hey, that is number 4. Number 4. All right, look at us, future nurses. Look at y'all. Y'all some smarty pants. Shout out to y'all. All right, remember, you need Q&A, content, rationales. You need all 3 of them. All right, here we go. Question number 7. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended for someone who has Addison's disease? Is it a diet high in grains, diet with adequate caloric intake, a high protein diet, or a restricted sodium diet? What are we thinking? Shout out to all 600 plus of y'all. Hey, I want to know who you are and where you're from and where you're at in your nursing journey. A little bit about me. I have been a nurse for 3.5 years. I've worked ICU, OR, and PACU. PACU is the holy grail, in my opinion. So if y'all want to go there, make sure y'all go there. And I was also in the Navy for 16 years. Got out this past January. I was an instructor, hospital corpsman, a master instructor. So shout out to all y'all that are out here trying to get y'all's learn on. Shout out to Texas, LVN, and shout out to you, Summer. All right. First semester in nursing school. I see you. RN, keeping fresh with you. I love that. From the Philippines. Shout out to you, Vina. All right. Here we go, y'all. Here's our answer in 3, 2. And the answer is a restricted sodium diet. A patient with Addison's disease requires normal dietary sodium to prevent excess fluid loss. Patients should eat an unrestricted diet. Those with primary adrenal insufficiency, aka Addison's disease, because you'll see both of them on your exam, should have ample access to salt because of the salt wasting that occurs in their condition, or if their condition is untreated. Infants with primary adrenal insufficiency often need 2 to 4 grams of sodium chloride per day. That is part of basic care and comfort. Basic care and comfort. What did I say? Did I say A? My bad. It's D. I said A because it says a restricted sodium diet. So cool. All right. Hey, chill out. Chill out. I see it. Lord have mercy. Man, y'all are wild on me right now. But anyway, basic care and comfort, 6 to 12% on the NCLEX exam. All right, on the NCLEX exam. See, look, there's a D, there's an A. Honest mistake, y'all. Honest mistake. Here we go. Question number 8. A patient with a history of diabetes mellitus is on the second post-operative day following a cholecystectomy. She has complained of nausea and isn't able to eat solid foods. The nurse enters the room to find the patient confused and shaky. Which of the following is the most likely explanation for the patient's symptoms? Is it the anesthesia reaction, hyperglycemia, hypoglycemia, or diabetic ketoacidosis? What are we thinking? All right, this is where you have to dissect your question, right? Somebody who has a history of diabetes, they had surgery, they complained about having nausea and vomiting and can't eat solid foods. So what do we think is happening? What do we think is happening? All right. That's how you have to answer these questions. Remember, NCLEX wants you have to be able to critically think in order for you to make a clinical judgment. That is what the test plan says, okay? Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is C, hypoglycemia. A postoperative diabetic patient who is unable to eat is likely to be suffering from hypoglycemia. Confusion and shakiness are common symptoms. Reduction in cerebral glucose availability can manifest as confusion, difficulty with concentration, irritability, hallucinations, focal impairment, and eventually coma and death. That is part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. 11 to 17%. I struggle with critical thinking part. Haven't really learned. That's what you got to learn. You got to understand how the disease processes work in order for you to understand how your patient's going to react so you can make a clinical judgment. Think about it when you guys were in clinicals, right? If you saw somebody displaying something, vital signs can tell you a lot. Hannah, you passed your NCLEX. Shout out to you. You already know what to do. Hannah, congratulations. Welcome to the greatest shit show on earth, known as being a nurse. If there's one thing that you could give advice for, what would it be? Once again, congratulations to you. Arlene, you passed as well. Y'all already know what to do. Arlene, y'all, that's like number 4 already. So shout out to Arlene. Shout out to Hannah. Congratulations to you both. Welcome to the greatest shit show on earth. Piece of advice from both of you. Congratulations once again. Here we go. Question number 9. A nurse assigned to the emergency department evaluates a patient who underwent fiber optic colonoscopy 18 hours previously. The patient reports increased abdominal pain, fever, and chills. Which of the following conditions poses the most immediate concern? Is it bowel perforation, viral gastroenteritis, colon cancer, or diverticulitis? All right, we've got a bunch of people screaming A. All right, shout out to everybody that's in here rocking with me. We're doing NCLEX questions. Hey, by the way, I'm about 600 followers away from 50,000 followers. I'm just saying. And so if you ain't following me, what are we doing? What are we really doing? All right, here we go. NCLEX questions, nurseslabs.com. Y'all go check them out for yourself. Is it Kiara? Thank you for the heart. I appreciate you. Here we go. And the answer is A, a bowel perforation. Bowel perforation is the most serious complication of fiber optic colonoscopy. Important signs include progressive abdominal pain, fever, chills, and tachycardia, which indicate advancing peritonitis. That's reduction of risk potential 9 to 15% on the NCLEX, which is the 4th largest section on the NCLEX exam. Kaylin says, Kevin, your review helped me pass my... Yes, that's what I'm talking about, Kaylin. Let them know. Let them know, Kaylin. Congratulations. Welcome to the greatest shit show on earth, known as being a nurse. Hey, let them know about my review and how it helped you. Let them know. You know what I'm saying? Let everybody know. But here we go. Question number 10. A patient is admitted to the same-day surgery unit for a liver biopsy. Which of the following laboratory tests assesses coagulation? Select all that apply. Is it A, partial thromboplastin time? Is it B, prothrombin time? C, platelet count? Or D, hemoglobin? What are we thinking? It says, Kevin, your review helped me out a lot. Your life specifically. Shout out to you, Hannah. Shout out to you. I appreciate that. Hey, if you guys don't know, I do these Monday, Wednesday, Friday, 5:30, and I got an NCLEX review, but we about to talk about that here shortly. All right. So what are we thinking? What are we thinking? All right. Hey, we're at 10,000. Hey, we're at question number 10, and I don't got 10,000 likes. What's up with that? What's up with that? I will tell everyone the NCLEX to follow you. I appreciate you. I appreciate you for that, Caitlin. Thank you. Here we go. Here we go. Here's our answer in 3, 2, and the answer is A, B, and C. Prothrombin time, partial thromboplastin time, and platelet count are all included in the coagulation studies. That is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam, making it the 4th largest section on the NCLEX exam. So shout out to everybody that got that question right. Well, I guess we didn't get to 10,000. Oh, look at that, man. Look at that. Y'all got me to 10,000 likes. I guess I'll go on to the next question. Ladies and gentlemen, right now, you guys can join the 7-day NCLEX course, plus be a part of the Boot Nurse 360 community right now. You can join starting at $7. You can do and jump in for $7. It is right there, thebootnurse.com/special. Hey, on Monday, we're doing Monday Motivation. We're doing Monday Motivation. I'm letting y'all know that right now. I'm bringing on guests. We're doing, I have another segment, which I call the Content Cafe. We're going to be going over and doing lectures. It's going to be on and popping here in the next week. So I'm letting you know, this is limited time for $7 where you guys can jump in. You guys can jump into the 7-day NCLEX course and be a part of the community for the 7-day NCLEX course. You get both for $7. Yes, it's for a limited time. And yes, it is a trial. I'll be very transparent about that. It is a trial. You get it for 7 days for $7, and then it goes up to $48 a month. So You guys want to be a part of that? Come check it out. And yes, it is for both RNs and LVNs, LPNs. All right, here we go. Question number 11. A nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? Is it sexual contact with an affected partner, contaminated food, blood transfusion, or illegal drug use? What are we thinking? What are we thinking? Somebody said, oops. Okay. All right, shout out to all 500 plus y'all rocking with me. We are doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check them out. You don't have to sit here and listen to me run my mouth on this live, but you know, you do you, boo. I'm just a tech. That's okay. Yeah, and then you're not just a tech. You know what I'm saying? You're not just a tech. You're doing a lot of work out there. Don't let people say that you're not. All right, here we go, y'all. Here we go. Here's our answer in 3, 2, and the answer, of course, is B. It is contaminated food. Hepatitis A is the only type that is transmitted from the fecal-oral route through contaminated foods. Hepatitis A is a single-stranded positive sense linear RNA enterovirus of the, oh my God, the picor. Whatever, that family. I'm not even going to say it because I don't care. And it's not going to matter, but it's part of safety and infection control. Safety and infection control. Wash your hands. Wash your hands, you nasty asses, okay? I'm talking about all you nasties. Wash them. That's why we do it. Hand hygiene is a real thing. Did I hear right? $7 for the course. Donnie, you did. You heard right. It's $7 to join the course plus being a part of the community. Wash your food. Yeah, you do that too. Yeah, period. Wash those hands, you nasties. Yo, get rid of those nails. If y'all didn't see that article that came out where somebody was actually spreading the diseases or whatever because of they found out the origins came from their nails. I'm just saying. Here we go. Question 12. A leukemia patient has a relative who wants to donate blood for transfusion. Which of the following donor medical conditions would prevent this? A history of hep C 5 years previously, cholecystitis requiring cholecystectomy 1 year previously, asymptomatic diverticulitis, or Crohn's disease in remission. What are we thinking? Hey, so here's another thing about me, ladies and gentlemen. I failed my NCLEX 3 times, not once, not twice, but 3. 3 times. All right. And let me tell you something. 2 people that are not going to ask you about it, your patient and the people that you're going to work for. All right. So, and I don't give a shit about what anybody tells you. That test will never determine the type of nurse that you will be. However, you got to realize that test is about safety and everybody has to have a standard to pass. So if you're one of those individuals who's nervous taking it your first time, or should I say those individuals who have failed it once or more than once and are scared to take it, get out of your own way. Stop being scared. That test don't got no feelings about you. So stop feeling like you got some feelings towards them. Get out of your own way and put in that work so you can get out here and take care of these patients and, turn your dream into a reality. You see what I'm saying? Stop playing games. Here we go. And the answer is A history of hepatitis C 5 years previously. Hepatitis C is a viral infection transmitted through bodily fluids such as blood, causing inflammation of the liver. Patients with hepatitis C may not donate blood for transfusion due to the high risk of infection in the recipient. That is part of safety and infection control, which is 10 to 15% on the NCLEX exam. So shout out to y'all. Shout out to everybody that got it right. And of course, if you got it wrong, go back and read your rationales, understand why the answer is right, but then understand why the other options are incorrect. All right. So shout out to y'all. Get out of your own way. You already know what the deal is. It says about to clock in. Good session. A, appreciate you. A, blessed. Here we go. Question 13. A physician has diagnosed acute gastritis in a clinic patient. Which of the following medications would be contraindicated for this patient? Which means which one should the doctor not give to this patient? All right. Is it, naproxen, calcium carbonate? Is it a Biaxin or is it furosemide? Lasix. No NSAIDs. Bleeding. Okay. All right, y'all. What else are we thinking? Shout out to everybody that's here. All right. And I'm telling y'all right now, I failed the NCLEX 3 times, y'all, and I passed on the 4th. And they were all it was the old test. It was not the new gen. All right. All right. And by the way, the 7-day NCLEX course, it is a self-paced course. It is a self-paced course. I have a new generation NCLEX review that's in there. That's 4 hours. And the 7-day NCLEX course, there are 4 or 5 days that are up there right now. And I'm still editing some stuff. The new gen, it's all about how the questions are delivered to you, and that's mostly given to you in a case study form. But here we go. And the answer is A. It is naproxen sodium. Naproxen sodium is a non-steroidal anti-inflammatory drug, an NSAID, that can cause inflammation of the upper GI tract. For this reason, it is contraindicated in patients with gastritis. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. The info is linked in my bio. Or you can go to thebootnurse.com/special. All right. So shout out to everybody that got that right. And if you got it wrong, you know what to do. Go back, look at it, read it, review it, and then go back and then do your content Q&A. That's how the rotation goes. All right. Question 14. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? The patient must maintain a low calorie diet, must maintain a high protein, low carbohydrate diet. The patient should limit sweets and sugary drinks, or the patient should limit fatty foods. What are we thinking? What are we thinking? Shout out to all 350 of y'all. We're doing NCLEX questions. I got them all. As I had my gallbladder removed. Oh, so you already know. That's kind of cheating. We're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. They also have nursing care plans over there for those nursing students that are in school. So if you're in school and you, one, haven't shared this, and two, haven't been to that website, you're wrong. And I'm going to need for you to fix yourself on both fronts. Yeah, make sure you guys go over there and check those out. Can you cancel the review if you have passed your exam? Yeah, if you've already passed, you can. If you've already passed, I don't see why you wouldn't. If you don't need it, you don't need it. Here we go. Question. Oh, I already said that, but here we go. Here's our answer in 3, 2, and the answer is D. The patient should limit fatty foods. Cholecystitis, which is the inflammation of the gallbladder, is the most common cause by the presence of gallstones, which may block bile from entering the intestines. Patients should decrease dietary fat by limiting foods like fatty meats, fried foods, and creamy desserts to avoid irritation of the gallbladder. That is part of health promotions and maintenance, 6 to 12% on the NCLEX exam. Smaller section, but still very, very much important. So shout out to you for getting it right. If you didn't, you know what to do. All right, here we go. Question number 15. A patient admitted to the hospital with myocardial infarction developed severe pulmonary edema. Which of the following symptoms should the nurse expect the patient to exhibit? Okay, so what should I expect to see with somebody who has pulmonary edema who had an MI? Is it a slow, deep respirations, stridor, bradycardia, or air hunger? What are we thinking? What are we thinking? Shout out to all 291 of y'all that are out here rocking with me. Man, I just had like 700 people in here. Where'd they go? That's wild. And we're on the road to 20,000 likes. 20,000 likes. Make sure you guys keep Hey, get carpal tunnel for me. Make it happen right now. Get carpal tunnel for me. All right. And we're going to answer this question. And our answer in 3, 2, 1. And the answer is air hunger. It is D. It is air hunger. Patients with pulmonary edema experience air hunger, anxiety, and agitation. Symptoms may also include coughing up blood or bloody froth, difficulty breathing when lying down, feeling of air hunger or drowning, which is like this feeling is called paroxysmal nocturnal dyspnea. If it causes you to wake up 1 to 2 hours after falling asleep and struggling to catch your breath. All right. That is physiological adaptation, which is the third largest section on the NCLEX exam. All right. At 11 to 17%. So shout out to everyone that got that right. Remember, if you don't know what anything means, I'm not going to give you the answer. That's not how I operate. I'm going to read you the question. We'll talk about the question slightly, and then we'll read over the questions or the answers. You guys will answer them. And that is why I read the rationales. It's so you read the rationale, because a lot of you won't read it. So now I force you to do it with me. Here we go. Question number 16. Somebody says, hey, Kevin, quick question. I can get something for 25 a month. Izzy, that's something different, and we'll talk about that. Question number 16. A nurse caring for several patients in the cardiac unit is told that one is scheduled for implantation of an automatic internal cardioverter defibrillator. Lord have mercy. Which of the following patients is most likely to have this procedure? Is it a patient admitted for myocardial infarction without cardiac muscle damage, a postoperative coronary bypass patient recovering on schedule, a patient with a history of ventricular tachycardia and syncopal episodes, or is it D, a patient with a history of atrial tachycardia and fatigue? What are we thinking? Izzy. So for everybody that bought the 7-day NCLEX course when it was in its pre-launch and where you could get it for a lifetime, you get the community aspect of the 7-day NCLEX course at a discount. That's where you see it for $25. That is where you see it for $25. For everybody else that jumps into the course now, you can jump into the course now, a trial for $7. And then after $7, it goes to $48 per month. All right. And like I said, we're going to be doing lectures in there. We're going to be doing some motivational Mondays. Like I got some good stuff planned for y'all up in there. All right. When does the special end? I haven't even decided that yet, so you might as well just get it when you can. Here we go. And our answer is C, a patient with a history of ventricular tachycardia and syncopal episodes. An automatic internal cardioverter defibrillator delivers an electrical shock to the heart to terminate episodes of ventricular tachycardia and ventricular fibrillation. This is necessary for a patient with significant ventricular symptoms such as tachycardia resulting in syncope. All right, that is reduction of risk potential, which is 9 to 15% on the NCLEX exam, making it the 4th largest section on the NCLEX exam. All right, I was wondering. Thank you for clarifying. You're welcome. Thank you, Jesus. My name is Kevin, but whatever. I'm just playing, but shout out to y'all. I got it right. And if you didn't get it right, you know why, and you know what you need to do. All right, here we go. Question number 17. A patient is scheduled for a MRI scan for suspected lung cancer. Which of the following is a contraindication to the study for this patient? The patient is allergic to shellfish, has a pacemaker, suffers from claustrophobia, or takes antipsychotic medications. What are we thinking? Shout out to everybody that is now joining. We are doing NCLEX questions. I got these off of nurseslabs.com. They are free sets of questions, so make sure you guys go over there and check those out for yourself. If you're in nursing school, they got really good care plans over there, so you guys can go check that out for yourself as well. But I also want to know who you are, where you're from, where you're at in your nursing journey. And yeah, make sure you guys keep smashing that like button and give me the 30,000 likes. What are we thinking? Dylan says B. Oh, my God. Okay. All right. OMG. Here we go. Now I'm feeling good about nursing school. All right, Carrie, feel good about it. Hey, knowledge is power. Here we go. Here's our answer in 3, 2, and the answer is B. The patient has a pacemaker. The implanted pacemaker will interfere with the magnetic field of the MRI scanner and may be deactivated by them. Patients with cardiac implantable electronic devices, or CIED, are at risk for inappropriate device therapy, device heating, or movement, and arrhythmia during the MRI. That is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. All right, 9 to 15% on the NCLEX exam, making it the 4th largest section on the exam. These are both for RNs and LPNs as well. All right, so, all right, and make sure if you got it wrong, make sure you read your rationales and you know what's up. If you got it right, make sure you read your rationale so you know what's up. Just saying. All right. Here we go. Question number 18. A nurse calls a physician with the concern that a patient has developed a pulmonary embolism. Which of the following symptoms has the nurse most likely observed? The patient is somnolent and decreased response to the family. The patient suddenly complains of chest pain and shortness of breath. The patient has developed a wet cough and the nurse hears crackles on auscultation of the lungs. Or the patient has a fever, chills, and loss of appetite. What are we thinking? What are we thinking? Shout out to all 200 plus of y'all rocking with me. Y'all could have been anywhere on this Friday, but you're here with me. Wait, today's Friday, right? Yeah. Y'all could have been anywhere on this Friday, but y'all are here with me, and I appreciate you. Hey, the work never stops. The work never stops. Here we go. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. The patient suddenly complains of chest pain and shortness of breath. Typical symptoms of pulmonary embolism include chest pain, shortness of breath, and severe anxiety. The physician should be notified immediately. Clinical signs and symptoms for pulmonary embolism are nonspecific. Therefore, patients suspected of having pulmonary embolism because of unexplained dyspnea, tachycardia, or chest pain, or the presence of risk factors for pulmonary embolism, must undergo diagnostic tests until the diagnosis is ascertained or eliminated, or an alternative diagnosis is confirmed. That's part of physiological adaptation. Physiological adaptation, which is 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX exam. Shout out to you, Vina, for in the Philippines. It's Saturday morning. Shout out to you. And who just gave me that rose? Sharita, thank you for the rose. And Ebony, thank you for the rose. I appreciate you. Here we go. Question number 19. A patient comes to the emergency department with abdominal pain. Workup reveals the presence of a rapid enlarging abdominal aortic aneurysm. Which of the following actions should the nurse expect? So what are the expected signs and symptoms of somebody who has a AAA, right? A patient will be admitted to the medicine unit for observation and medication. The patient will be admitted to the day surgery unit for sclerotherapy. The patient will be admitted to the surgical unit and resection will be scheduled, or the patient will be discharged home to follow up with his cardiology in 24 hours. What are we thinking? What are we thinking? Shout out to y'all. Those that are just now joining, my name is Kevin. I go by the Boot Nurse on all social media platforms, to include YouTube. You guys can find me over there. I've been a nurse for 3.5 years. I was in the Navy for 16. I failed my NCLEX 3 times and I passed on the 4th. And I don't care what you got to say about that. Just saying. You're going to meet a lot of people real fast. Yeah. You're going to be like, Grandma, what are you doing here? Let me stop. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer, of course, is C. The patient will be admitted to the surgical unit and resection will be scheduled. A rapidly enlarging abdominal aortic aneurysm is a significant risk of rupture and should be resected as soon as possible. No other appropriate treatment options currently exist. That's true. Somebody got a AAA, they go into surgery. That's what's happening. All right. So that is reduction of risk potential. Reduction of risk potential, which is 9 to 15% on the NCLEX, making it the 4th largest section on the NCLEX exam. One thing I need for RNs and LPN students to realize is that doesn't matter. You learn the same content. The content is still the same that you learn in your prospective nursing programs. The thing that is different is your role, responsibility, scope of practice, what you can and can't do, what you can and can't accept. Once you get that understanding, you are okay. Trust and believe me when I tell you that. Here we go. Question 20. A patient with leukemia is receiving chemotherapy that is known to depress bone marrow. A CBC reveals a platelet count of 25,000 microliters. Which of the following actions related specifically to the platelet count should be included in the nursing care plan? Monitor for a fever every 4 hours. Require visitors to wear respiratory mask and protective clothing, consider transfusion of packed red blood cells, or check for signs of bleeding, including examination of urine and stool for blood. What are we thinking? Let me give you guys 15 seconds. All right. Everybody's telling me D. Everybody's telling me D. I haven't seen nobody say anything else but D. But we'll see, though. Amanda says A. Okay, there's one. There's one that is going against the grain, going against the norm that everyone else is. Kim says A as well. So does Marie. Okay, so we're between A and we're between D. You're thinking C? Come on, Keisha. You got to give me one. If everyone doesn't say A, I'm going to say stop it. Everyone didn't say A. Even if you don't know, apply what you do know. All right, here we go. Here's our answer. Here's our answer in 3, 2, and the answer is D. We are going to check for signs of bleeding, including examination of urine and stool for blood. A platelet count of 25,000 microliters is severely thrombocytopenic and should prompt the initiation of bleeding precautions, including monitoring urine and stool for evidence of bleeding. That, once again, is reduction of risk potential. The normal platelet count is 150,000 to 400,000. All right. That is what the normal platelet count is. Anything drastically under 150,000 microliters for platelets, you're going to be thinking thrombocytopenic. Right? Thrombocytopenic, right? They're neutropenic, or not neutropenic, I'm sorry. You're going to be thinking about bleeding precautions. All right? The way you said, get out of my ass, shook me out of my slump I was in. Thank you. Yeah. Yasmin, you are very welcome. I'm telling you, get out of your own way. And I'm going to tell you why. Because no one cares. Truly, truly, no one cares. Think about those people you went to school with. You think they give a shit about the fact that you failed? They don't care because they passed. You see what I'm saying? They didn't allow for their nervousness, even though maybe they did. They didn't allow it to stop them. And guess what? As they progress, you sit here in your own little slump whining and complaining about it. Right? Instead of whining and complaining about it, how about you make actionable steps? And that's what I actually teach people when we talk about coaching, because I actually coach people through NCLEX with coaching and mentoring. I actually have, believe it or not, 100% pass rate. One of the gentlemen that I coached this week, or for the past month, he took his NCLEX this week on Tuesday, found out yesterday that he passed. Right? And I'm waiting on that testimony. I'm telling you, keep going. Keep going. This is your journey. It's not mine. It's your personal journey. While we all have the same destination, getting a license to get out here to work. And then eventually, turn that dream into a reality. So if you're one of those individuals who doesn't know how to get out of your own way, who has difficulty understanding NCLEX style questions, needs guidance, needs mentorship, wants to understand how the content is related to the questions, and you need somebody to hold you accountable, I got you. Check me out, thebootnurse.com/coaching. Fill out the questionnaire and then come holla at me. So it says you already did the hard work. Exactly, Emily. Look, you guys are honestly, the hardest part about your nursing journey now, honestly, is getting through school. That's what it's about. Is it Mimi? Thank you for you're welcome. That's what I do. That's what I do every time. Question 21. A nurse in the emergency department is observing a 4-year-old child for signs of increased intracranial pressure after a fall from a bicycle resulting in head trauma. Which of the following signs or symptoms would be cause for concern? Is it a bulging anterior fontanelle, repeated vomiting, signs of sleepiness at 10 p.m., or inability to read small words from a distance of 18 inches? What are we thinking? Now, think about it. I'm just going to ask you these questions. This is how you do the process of elimination. Does a 4-year-old have a bulging fontanelle? Okay, cool. Will a 4-year-old have repeated vomiting after falling off of a bike and then getting increased intracranial pressure in their head? Will they have vomiting? Okay, cool. Would a 4-year-old have increased sleepiness at 4 or at 10 p.m.? Probably. Oh, okay, sure. Or is it D, inability to read short words from a distance of 18 inches? Now, can a 4-year-old read? Can a 4-year-old read? Let alone read something from 18 inches away. I don't know. You tell me. So think that's how you have to do it. That's how you have to do it. All right. Now here's our answer. And our answer is B. It is repeated vomiting. Repeated vomiting. Miss G, I cannot with you. I appreciate you. Here we go. So increased pressure caused by bleeding or swelling within the skull can damage delicate brain tissue and may become life-threatening. Repeated vomiting can be an early sign of pressure as the vomiting center within the medulla is stimulated. That is physiological adaptation, which is making it the third largest section. Third, he a baby genius. I know, talking 18 inches away. Right. So shout out to everybody that got that question right. Of course, Miss G just got me to my goal. I appreciate you. Thanks so much. All right. And remember, if you got it right, you know what to do. If you got it wrong, you really know what to do. All right. Here we go. Question number 22. A non-immunized child appears at the clinic with a visible rash. Which of the following observations indicates that the child may have rubella or measles? Is it a small blue-white spots are visible on the oral mucosa. The rash begins on the trunk and spreads outward. There is a low-grade fever. The lesions have a teardrop on a rose petal appearance. It says, baby genius, that passes the Snellen, right? If it's not, nurse, stop it. I cannot. Y'all are wild. Nurse Daddy K. I can't even believe I said that and that actually stuck. Y'all are wild. Hey, but if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys smash that like button, you guys share, and you guys follow. I appreciate you being here with me on this Friday because you're still putting in that work. Because just because the weekend's here doesn't mean work stops trying to accomplish those goals. So we're on the road to 30,000 likes. Make sure y'all get carpal tunnel for me and stop playing these games. But here we go. Here is our answer. Here is our answer in 3, 2. And the answer is A. A small blue-white spots are visible on the oral mucosa. Complex spots are small, blue-white spots visible on the oral mucosa and are characteristic of measles infection. Yep, and that's it. That's what it is. Health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Smaller section for the client needs, but still very important because it's part of the 8 sections of the client needs. All right. So make sure you guys are going over there and checking those out. Right. Go check those out, nurseslabs.com, but make sure you guys are reading your rationales. Your rationales help you retain the information. I go live Monday, Wednesday, Friday, 5:30. All right, here we go. Question 23. A child is seen in the emergency department for scarlet fever. Which of the following descriptions of scarlet fever is not correct? Meaning 3 of them will show scarlet fever and 1 of them will not. Which one will not? Scarlet fever is caused by infection with group A Streptococcus bacteria. Strawberry tongue is a characteristic sign. Petechiae occurs on the soft palate. The pharynx is red and swollen. What are we thinking? What are we thinking? I got A, C, I got B, 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 D, B, B, A. Okay, all right. Shout out to all 169 of y'all out here rocking. Hey, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? What are you doing here hanging out with us? Trying to get your learn on. I've had so many other people in here that aren't nurses. And I love it. Everybody can get a learn on. All right. Carolina, VA now. Oh, Virginia now take NCLEX at the end of March. Shout out to you. Q2, Amanda. Okay. Shout out to you. All right. What else we got? We got C. Janelle says C. I'm a junior in high school. Shout out to you. Who is that? A 911 dispatcher. Just get my learn on. I love it. Nursing lecturer, improving myself in New Zealand. Shout out New Zealand. Okay. Here we go, y'all. Here's our answer in 3, 2. And our answer is C. Petechiae occurs on the soft palate. Petechiae on the soft palate is characteristic or is a characteristic of rubella infection. That is part of that's part of physiological adaptation, which is the 3rd largest section on the NCLEX at 11 to 17%. So shout out to everybody that got that right from the Bronx. Okay, that was a tricky one. Yeah, it was not a nursing school, but I'm very interested in the medical field and I love to learn. I love to see it. 5 weeks left of my RN. Shout out to you, Heather. Yuli says 2nd semester nursing school. Don't cry. Hey, it's part A. It comes with the territory, part of the growing pains, right? Here we go. Question number 24. A child weighing 30 kilograms arrives at the clinic with diffuse itching as a result of an allergic reaction to an insect bite. Diphenhydramine 25 milligrams 3 times a day is prescribed. The correct pediatric dose is 5 milligrams per kilogram per day. Which of the following best describes the prescribed drug dose? Is it A, the dose is correct, B, it's too low, D, it's too high, C, it's too high, or D, the dose should be increased or decreased depending on the symptoms? So what do we think? Just applied for nursing school. Shout out to you. Is it Italia? Shout out to you. You're going to get it. You're going to get it. We got C, Samantha, Alexis, Liliana. I'll say C. New Orleans, Access Navigator. Shout out to you, Dion. Shout out to New Orleans, baby. All right, I'm done. No more of that. Joy says B. Oh, it says I only work with adults, but that's okay. That's okay, Emily. Ain't nothing wrong with that. I ain't never worked peds either, so I'm just keeping it real. But I guess dosage calculation is dosage calculations, right? Gina says B. Amanda says C. All right, shout out to y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B. The dose is too low. This child weighs 30 kilograms and the pediatric dose of diphenhydramine is 5 milligrams per kilogram per day, which is 5 times 30, which equals 150 per day. Therefore, the correct dose is 150 milligrams a day. Divided into 3 doses per day, the child should receive 50 milligrams 3 times a day rather than 25 milligrams 3 times a day. Dose should not be titrated based on symptoms without consulting a physician. That is part of pharmacological and parenteral therapies. Dang, I'd be passed out, right? Pharmacological and parenteral therapies, which is the 2nd largest section on the NCLEX at 13 to 19%. So once again, shout out to everybody that got that right. And if you didn't, read your rationales. And if you have a hard time with dosage calculations, practice. Find you some dosage calculation practice questions and practice. All right, here we go. Question number 25. The mother of a 2-month-old infant brings the child to the clinic for a well baby check. She is concerned because she feels only one testes in the scrotal sac. Which of the following statements about the undescended testes is the most accurate? Normally, the testes are descended by birth. The infant will likely require surgical intervention. The infant probably only has one testis. Normally, the testes descend by 1 year of age. What are we thinking? Shout out to everybody rocking with me. We got 161 people in here. I appreciate y'all. Hey, y'all, give me the 30,000 likes. Hey, get carpal tunnel for me right now. Make it happen. All right. If you guys are just now jumping in, these are both for RNs and LPNs. RNs and LPNs. All right. And if you're a nursing student and you haven't shared this with people in your cohort or whoever you're in cahoots with, I'm gonna need for you to do that. I'm gonna need for you to fix yourself. All right. Here we go. Here's our answer. Here is our answer. Is it Haley? Haley A. I see you. You literally said D like a million times. Here we go. Here's our answer in 3, 2, and the answer is D. Normally, the testes descends by 1 year of age. Normally, the testes descends by 1 year of age. Yep, sure does. In young infants, it is common for the testes to retract into the inguinal canal when the environment is cold or the cremasteric reflex is stimulated. The exam should be done in a warm room with warm hands. It is most likely that both testes are presented and will descend by a year. If not, a full assessment will determine the appropriate treatment. That is part of the health promotions and maintenance, which is 6 to 12% on the NCLEX exam. 6 to 12%. If you got it wrong, ladies and gentlemen, anytime you get it wrong, you need to read your rationales. Hey, and here's another trick. Once you get it right, you want to read your rationales. Always read your rationales, especially if you got them wrong, but even if you got them right. All right, here we go. Ladies and gentlemen, if y'all don't know this young lady right here, this is Joy. Joy actually bought my 7-day NCLEX course and she used it. She used the next generation review that's in there and she passed on January 31st of this year. So shout out to her. And just letting you know, hey, it works. The review works. And ladies and gentlemen, if you don't know who this young lady is, this right here is Crystal. She failed her NCLEX 3 times and she actually reached out to me because she was interested in being coached on how to pass the NCLEX. When I tell you she was a different person in December, we worked for a month, a little over a month, and she took her NCLEX on the 5th of May. The 5th of February, and then got her results on the 6th of February. And now Miss Lady right here is an RN. So just letting y'all know, coaching works. Coaching works. The course works. I have 100% pass rate with my coaching 101. Hey, if that's something that you're interested in, you can check those links out, and those links are in my bio. All right, here we go. Question number 26. A child is admitted to the hospital with a diagnosis of Wilms tumor stage 2, which of the following statements most accurately describes this stage? The tumor is less than 3 centimeters in size and requires no chemotherapy. The tumor did not extend beyond the kidney and was completely resected. The tumor extended beyond the kidney but was completely resected. Or is it D, the tumor has spread into the abdominal cavity and cannot be resected? What are we thinking? What are we thinking? Shout out to all of y'all. All right. Elizabeth says B. It says Amanana says C. Joy says A. Okay. Shout out to all 150 of y'all. Hey, we're almost at 30,000 likes, y'all. We're almost at 30,000 likes. Almost there. Almost there. But here's our answer. Hold on. Stella Marie, passed my NCLEX at 85 questions. Your lives help so much. Shout out to you. Oh, hold on a second. Shout out to you, Stella Marie. I appreciate you. I appreciate you coming back here and letting us know. Congratulations to you. Welcome to nursing, aka the greatest shit show on earth. If you could give a piece of advice to anybody that's studying for the NCLEX right now, what piece of advice would that be? And once again, ma'am, congratulations to you. Here we go. The answer is C. The tumor extended beyond the kidney but was completely resected. The staging of Wilms tumor is confirmed as at surgery as follows. Stage 1, the tumor is limited to the kidney and completely resected. Stage 2, the tumor extends beyond the kidney but is completely resected. Stage 3, the residual homogeneous tumor is confined to the abdomen. Or stage 4, homogeneous metastasis has occurred with spread beyond the abdomen. And stage 5, bilateral renal involvement is present at the diagnosis. That is physiological adaptation, which is 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX exam. So remember, if you got this one, here's the thing, if you truly don't know this piece of content, there's nothing wrong with you guessing, okay? I'd rather you have a 25% chance of getting it right if you guess versus if you didn't guess at all and you got it wrong. But I think NCLEX make you do it anyway. So I'm just saying, it says study test strategies just as much as content. Yep. You definitely want to study the content. I'm telling you right now, you definitely want to study the content. So shout out to y'all. Here we go. Question 27. A teen patient is admitted to the hospital by his physician who suspects a diagnosis of acute glomerulonephritis. Which of the following findings is consistent with this diagnosis? Select all that apply. Well, first of all, you need to understand what glomerulonephritis is, and you need to know what the expected signs and symptoms are for somebody that has that issue. All right. So is it a urine specific gravity of 1.040, urine output of 350 mLs in 24 hours, brown tea-colored urine, or generalized generalized edema? What are we thinking? Shout out to all 150 of y'all where you're doing NCLEX questions. I appreciate everybody being here. We're doing NCLEX questions, so make sure you guys like, share, follow. Make sure you guys give me the 30,000 likes. If I ain't there already, no, we ain't there yet. We almost there though. We almost there. We got B's and C. Hey, so this is a select all that apply. So it could be one, it could be, two, or it could be all of them. Yeah, and select all that applies. They do that now. It's rare, but they do it. Here we go. Here's our answer in 3, 2, and the answer is A, B, and C. All right. Acute glomerulonephritis is characterized by high urine specific gravity related to oliguria, as well as a dark tea-colored urine caused by large amounts of red blood cells. All right. That's what it is. That is what it is. Reduction of risk potential 9 to 15% on the NCLEX, making it the fourth largest section on the NCLEX exam. The top four: management of care, pharmacology, physiological adaptation, and reduction of risk potential. So shout out to everybody that got that right. And if you got it wrong or right, you know what to do. Here we go. Which of the following, for question 28, which of the following conditions most likely causes acute glomerulonephritis? Is it a congenital condition leading to renal dysfunction? Is it a prior infection of group A streptococcus within the past 10 to 14 days? A viral infection of the glomeruli? Or is it a nephrotic syndrome? What are we thinking? Shout out all 145 of y'all rocking with me on this Friday. Got these questions off nurseslabs.com. So what are we thinking? Everybody saying B. Somebody say D. Okay. Endurance says C. Willow says C. Okay. All right. I'll give you 10 more seconds. Kim says B. Okay. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. Prior infection with group A streptococcus within the past 10 to 14 days. Acute glomerulonephritis is most commonly caused by the immune response to a prior upper respiratory infection of group A streptococcus. Oh my God. Was a glomerular, I was about to say glomerular, okay, I can't say that. Glomerular inflammation occurs about 10 to 14 days after the infection, resulting in scant dark urine and retention of body fluid. Periorbital edema and hypertension are common signs at diagnosis. That's part of physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%, and it's still very, very much important. So, hey, somebody gets acute glomerulonephritis, they start having an acute kidney injury. Think about it. Hey, did they have an upper respiratory infection in the last 2 weeks? They're going to be like, yes or no. And you're like, oh, there it is. That's a huge culprit for it. So think about that. That's how you use your critical thinking to apply it and make a clinical judgment. Okay, here we go. Question 29. An infant with hydrocele is seen in the clinic for a follow-up visit at 1 month of age. The scrotum is smaller than it was at birth, but the fluid is still visible on illumination. Which of the following actions is the physician likely to recommend? Is it massaging the groin area twice a day until the fluid is gone? Refer to a surgeon for repair. No treatment is needed. The fluid is reabsorbing normally. Or D, keeping the infant in a flat supine position until the fluid is gone. What are we thinking? What are we thinking? I'll give you guys 20 seconds. Y'all got me to 30,000 likes. I appreciate you. I appreciate you so much. I appreciate everybody that comes here religiously and gets their learn on. All right, we got some B's, we got some C's. Okay. What else we got? Okay. We got some B's and C's. It looks like mostly B and C. Mostly it looks like B and C. Thank you, Kim. I appreciate you. Here we go. Here's our answer in 3, 2, and the answer is C. No treatment is necessary. The fluid is reabsorbing normally. A hydrocele is a collection of fluid in the scrotum that results from a patent tunica vaginalis, right? Illumination of the scrotum with a pocket light demonstrates the clear fluid. In most cases, the fluid reabsorbs within the first few months of life and no treatment is necessary. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX, smaller section on the NCLEX exam, but still very much important for the 8 sections of the client needs. It says moms of boys know. Yeah, they do. Yeah, they do. When my son was born, that's exactly what mom was looking for. Like, whoa, hey, what's going on over here, right? So shout out to everybody that got that question right. Hey, but if you got it wrong or right, you know what to do. Here we go. Question number 30. A nurse is caring for a patient with peripheral vascular disease. The patient complains of burning and tingling of the hands and feet and cannot tolerate touch of any kind. Which of the following is the most likely explanation for these symptoms? Is it inadequate tissue perfusion leading to nerve damage, fluid overload leading to compression of nerve tissue, sensation distortion due to psychiatric disturbance, or is it inflammation of the skin on the hands and feet? What are we thinking? What are we thinking? Shout out to all y'all that are here rocking with me. If you're new here, we got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. My name is Kevin. I've been a nurse for 3.5 years. I've worked OR, ICU, and PACU. So that's just a little bit about me. And of course, I want to know about you. I want to know about you, who you are, where you're from, and where you're at in your nursing journey. But here's our answer, ladies and gentlemen. Diamond, you are welcome. But here is our answer in 3, 2. And the answer is A, inadequate tissue perfusion leading to nerve damage. All right. Patients with peripheral vascular disease often sustain nerve damage as a result of inadequate tissue perfusion. Ischemic rest pain is more worrisome. It refers to pain in the extremities that is due to a combination of PVD and inadequate perfusion. Ischemic rest pain often is exacerbated by poor cardiac output. The condition is often partially or fully relieved by placing the extremities in an independent position so that perfusion is enhanced by the effects of gravity. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. So once again, if you got it wrong, you know what to do. If you got it right, shout out to you, but you also still know what to do. All right. Make sure you guys read those rationales. If you don't get it, go back to do your content. Keep doing your Q&A. Keep doing your rationales. That is the trifecta that you need. All right. That is the trifecta that you need. Ladies and gentlemen, of course, if you missed out on everything that we talked about today, go over there and get you a free set of test questions. Also, if you're looking for an ebook that's over 700 pages that I go over everything, EKG interpretation, there's some doses calculations in there, management of care, pharmacology stuff. You guys go over there and check that out, thebootnurse.com/victory. Also, for now, the 7-day NCLEX course, ladies and gentlemen, you can join the course as well as the community for $7. You can join for $7, right? The community, it is an ongoing thing, all right? And you get all the videos everything that I get that's in the course that I have, you are privy to, and it is on a subscription. So $7, go over there and get your learn on. And of course, if you're one of those individuals that needs help, you failed the NCLEX, you don't want to fail the NCLEX, you're nervous, you don't know where to start, begin, you don't understand questions or answers, you want accountability, I got you. Check that out, thebootnurse.com/coaching. And ladies and gentlemen, that is a wrap. That is a wrap for this Friday. Once again, I appreciate you all for participating. I love all the likes and all the love and all that. Shout out to Miss G for getting me all the way to my gift goals. Once again, I don't gatekeep. I got these questions off nurseslabs.com. Whether you like them or not, they are sets of questions that are there for you and they help. So go over there and check them out. Also, 7-day NCLEX course in the community. Like I said, you can join it for $7. The link is also in my bio, or you can go to thebootnurse.com/special. And once again, I have a free download over there. You want one-on-one coaching for the NCLEX? You failed it once or twice, 12 times, whatever. Come holler at me. Thebootnurse.com/coaching. I'll get you right. All right. And with that, ladies and gentlemen, I'm going to turn this camera around. And be like, hey, yo, what up? What's up, y'all? Hey, I'm going to hang out here for about maybe like a few minutes and answer some questions. But of course, if you guys are new here, I appreciate you guys being here. You guys got me to 30,000 likes. So who am I to complain? Right? Liliana says, hello, Kevin. I've been trying to make a 15-minute appointment with you, and I didn't know what I was doing. Liliana, so you should have got an email. If you didn't get an email, I think I saw your name, but I'll go in there and I'll send you the link. But you should have. There's usually, after you do the questionnaire, it'll say, hey, tap this, and it'll take you to where you can schedule your call. So I'll send that to you once I get off here. But what questions do you have? It says, what's your advice for a first-time taker who failed? So if you're not a first-time taker if you failed, you would be a repeat test taker if you failed it the first time. So the first thing I'm going to tell you to do is look at your candidate performance report, or your CPR, or whatever they call it. Look at the section that you didn't do well on, and that's the section that you need to tackle first. White Eyes, you're welcome. Liliana, you're welcome too. So that would be my advice on where you should start. All right. And then also think about other things, like, how did you study? What type of learner are you? What was your environment like? How was your support system? Did you schedule out your day? Did you recreate the testing center? Like, those are all things that people need to know and recognize. And if you didn't do them, you might want to implement them. You might want to do that. All right. So what other questions do you guys have while I hang out here for a minute? It says, thanks, below passing in pharmacology. Well, guess what? Guess where you starting then? Pharmacology. Because guess where I had below when I failed? Pharmacology. I sure did. So what other questions do you guys have? You guys see this rogue gray hair here just chilling? I am not a fan of that. I am not a fan. So, but what else? What other questions do you guys have for me? Because if you guys don't got no questions, I'm gonna go handle some business. Mostly I'm gonna go eat, but I got some other stuff, I got some content to put inside of this course, right? So, what'd you say really for? Why? What happened? What I do? Dion, thank you for the follow. I appreciate you. Hey, so if you guys are just now joining, we just finished doing an NCLEX essentially review, where we went through questions and answers and rationales. We do them every Monday, Wednesday, Friday at 5:30. So make sure you guys like, share, and follow and be a part of that. How do you start studying again after failing? Get out of your own way. Like, you're asking me how to start failing. The next thing I'm going to be like, okay, so why haven't you started? You're going to tell me that you're nervous, anxious, you're scared, and yada, yada, yada. The first thing I'm going to say to you is get over that. And until you realize that you are allowing your feelings and emotions to defy logic, you're never going to tackle it again. So what you need to do is you need to make actionable steps, imperfect, actionable steps. That's what you need to do. You need to realize that this is just an exam. What's up, Nurse Tibby? How are you? But you need to make actionable steps. You need to realize that this is an exam and it don't got no feelings towards you. You're the ones who has feelings about that. And you want to know where that comes from? Two places: your anxiety, your nervousness, and those professors and instructors that you work with. Because most of them will be like, you don't want to fail this exam, blah, 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 blah. It's going to be the end of the world. No, it's not. No, it's not. No, it's not. You missed the lecture. Yeah, I'm done. I just finished. So, Jalea, I would say get out of your own way. I have a term, or I have a phrase where I say get off the beach. Nurse Tibby loves it when I tell this story. But when I tell you get off the beach, get off of it. It's a World War II reference, during the beaches of Normandy. Either there were two people that stayed on the beach, the dead and those that were going to die. So the only way that you're going to survive is to get off your beach. You need to get off the beach. All right. You're going to be scared. You're going to be nervous. But guess what? You're going to be scared. You're going to be nervous, and you're going to go that way. All right. Nobody ever did anything or accomplished anything great without being scared. Don't let them lie to you. Don't ever let them lie to you. All right. Let me see. Viviana says, I took mine on the 26th, but I still need more time to review. I'll take my second, I guess, later this year. How about you tell me? So when I tell you, I need you to solidify something. This is for, is it Vina? I need for you to, you're like, I guess I'll take it. Don't you tell me I guess. That's just like telling me I hope. And this isn't fucking Star Wars, okay? If don't tell me that you're going to guess you're going to do something. Put in the work, turn around, give yourself another month to 2 months, study for that exam, and go take that shit again. How do you get your candidate performance report? If you haven't gotten it, contact your board of nursing and they'll send it to you. It says, can you pluck it out? It says, get really close and plug. Nah. Oh yeah, I know how to pluck it out. I embrace the gray hair, to be honest. That's all good with me. Thanks for the review. You're welcome. Never stop moving forward. Nice to see your face. What's up, Miss Kathy in the wild? Hey, I just want to let you know your lives are awesome. By the way, Kathy, I love them. Way to pivot. So I never stop moving forward. Never, ever. Yes. Get off the beach. Love it. Makes sense. Love it. I'm glad that you love it. And I'm glad it makes sense to you. I'm glad it makes sense to pretty much everybody. All right. Who just filled that out? Okay. Somebody just filled out one of my questionnaires. So hopefully I'll be able to see them soon. You're welcome, Kathy. Yeah. What other questions do you guys have? Who did I say that to? Was it Vina? Vina, if you're still here, I hope that makes sense. I hope that didn't scare you off. I'm a very straight shooter. Like, you're not going to come to me and be like, oh my God, Kevin, like, I just don't know what to do. I'm going to be like, hey, how about you dry those fucking tears up and we get to work? And you're going to be like, okay, exactly. And that's all it needs. That's all some people need. You know? So it says, thanks, Kevin. I'll do that. Hoping. Hey, I don't want to hear hoping. I want you to tell me what you are going to do. Tell me what you're going to do. Tibby, I appreciate you. Thank you. Thank you for the finger heart. Hoping to have the U.S. license. Love from the Philippines. I'm going to the Philippines. Somebody's gonna be a tour guide for me. Damn it, I'm not playing. So I need to get to work. That's what I'm talking about. You will never, if you don't put in no work, you will. How you expect to get anything? Jalay, thank you for the finger heart. I appreciate you. So like, you got to put in the work. Like, what are we doing? What are you doing? You expect somebody to just give you a license? You expect somebody to just give you the experience? You have to go through these steps in order for you to be part of the crew. This isn't hashtag, fake Florida nurse. What we look like? Just saying. Shout out to all my nurses, though. Shout out to all my Florida nurses that are real nurses out here that ain't trying to fucking, skim the system. So does a 7-day NCLEX course have Q&A? It does not have traditional questions and answers where you can go in and do a quiz. It does not have that. However, what it does have, it has a new generation NCLEX review where I go over questions and answers just like I did here. And I talk about reading the rationales, talk about, breaking down the question, so on and so forth. So that's what it has as of right now. Still growing, and I am working on getting my own sets of some questions that are in there. But there's some places that have questions that are not good, and I'm just like, if I know that they're not good, I'm not going to even try to even remotely put this in front of any of my students. So hard work now, chilling later. Facts. Yep. Gain that experience. You went there. I did go there with the Florida nurses. I did. But shout out to all 57 of y'all out here rocking with me. I'm going to hang out for a few more minutes. If you missed the review, sorry, should have got here. But then again, I started a little bit later. But you need to make sure you're following me and you need to have those notifications on. So that way, when I do go live, even if I'm not doing questions, you need to be here and participate. All right. But we did questions. We did answers. You know what I'm saying? Now we're doing an Ask Me Anything. I appreciate everybody being here. Good night, Nurse Thibodeau. I appreciate you always. So what other questions do you guys have? What about the NCLEX Victory Guide? What about it? What about the NCLEX Victory Guide? So the NCLEX Victory Guide is over 700 pages. It's an ebook. It's yours. Once you buy it, it's yours. Over 700 pages that are in there. EKG interpretations that are in there. Tons of pharmacology is in there. Management and delegation is in there. So, growth and development is in there. A lot of good stuff that's in there. What's super fun? Samantha. Yeah, Samantha, you come here often. I see you. So I'm glad that you think it's fun. It says that's crazy that they could pass the NCLEX and some can't. It is crazy. It is crazy because guess what? If everybody passed the NCLEX, it would be 100% pass rate. And it's not. Like, the pass rate, I want to say for 2023 was at like 88%. Before that, the year before that, for 2021, 2020, 2021, and 22, they were like in the 70s. They were in the 70s. And repeat test takers, once you fail it the first time, your chances of passing it the second time and after that is like 51%. So, just think about that. Just think about that. Do I want you to pass on the first time? Of course I do. I don't ever want anybody to experience what I felt and just not being able to be successful. But you would be naive to think that people wouldn't pass it. And then it's like when you don't pass it, people kind of give you the side eye, like, bitch, you dumb. Like, we got to change that narrative. I worked in the OR for a year, and before they even knew it, they were just like, wait, you failed your exam 3 times? I'm like, yeah. They were like, I would have never guessed that. Why does it go down to 51%? What happens when somebody fails, and it happens with everybody, is they lose all of the information that they normally would have while they were studying the first time. And then they have to wait 45 days before they can take it again. And within those 45 days, they stop studying. And when they stop studying because they get discouraged. And when they get discouraged, they lose the motivation. And then it's all a downward it's all downward from there, if that makes sense. But that's what happens. And the reason why I know that happens is because it happened to me, as well as every person that I've coached has said the same exact thing. And if anybody that's a repeat test taker in here that eventually passed it besides me can agree with that, please let me know. So why do it? Yeah, but yeah, Joyce, that's exactly why it goes down. So, but hey, appreciate everybody hanging out with me. Yes, it's true. It does happen. Absolutely. It does happen. And that's okay though. But that's okay. Because once again, the one thing that a sick patient wants is to not be sick. And I can tell you right now, you can be the best nurse on earth and have passed and failed your NCLEX 3 or 4 times. Sorry. It's funny when you see somebody who's sick and they want you to help them, but you're a great nurse, but you failed that exam multiple times. Guess what? They're not going to be like, you failed your NCLEX 4 times? I can't breathe. Bring in another nurse. They're going to look at you like, all right, cool, whatever. You know what I mean? So get out of your way. Get out of your own way. When you fail your exam, you are your own worst enemy. You are your own worst enemy. So get out of the way. Step aside and then let yourself walk past and then keep going. So what other questions do you guys have? I'm hanging out here for another 4 minutes. If you guys just now joined, we finished NCLEX questions. We do them every Monday, Wednesday, Friday at 5:30 Central Standard Time in the evening, right? In the evening. Somebody was like, do you do them at 5:30 in the morning? I don't know. I'm here talking to you at 5:30 at night. So you tell me. What you mean, guy? So, of course, I always want to know where people are from. Always make sure you guys go over there and check out what I got going on at thebootnurse.com. The 7-day NCLEX course. Hey, you guys can do a 7-day trial for $7. For $7, you guys can jump in. I got 64 videos that are in there to include a 4-hour new generation NCLEX review where I go over 100 questions. 100 questions. I go over them and we talk about them. We break them down. Keywords that you need to listen out for. Things where I inflect and I emphasize, like, hey, so what are we thinking about? I give you the topic, so it actually kind of helps hone you in onto like, oh, so this is that area that I could potentially be thinking about. On NCLEX, it's not like that, but to help you study, I think it's actually a really great tool to put the topic, because it helps you kind of narrow it down. That way, when you go and take your NCLEX, you'll be like, that sounds real familiar. That sounds real familiar. Okay, yeah. I remember Kevin saying that. Or, of course, if you hear my motivation, because y'all think I talk a lot, which is fine, but this is what I do. I love it. By the way, to all 52 of you, I have a book coming out. And or hopefully we're going to be pre-launching that next week. I'm just waiting on my book cover to come back, and then once it comes back, it's going to be on and popping. It's going to be a paperback book, and you're going to be able to buy it off Amazon. I just need, if there's anything that you ever hear me tell you to do, which I will always love, is the support that people give me. Go check that book out. Go check it out when it comes out. And you want to know what it's going to be called? It's going to be called Conquer It. See what I did there? It's going to be called Conquer It. the journey to passing the NCLEX. You see what I'm saying? Because guess what? Everybody's journey is different, right? Everybody's journey is different. I don't know what Joyce got going on. I don't know what Geraldine got going on. I don't know what Samantha got going on. Nothing like that, right? I just know what Kevin got going on. And by me telling y'all my story of overcoming, failing that exam multiple times and then passing it, I want that to be a catalyst for you to read and open up and be like, yo, okay, like I can't let this test beat me. I can't let this test beat me. By the way, everybody that I've ever coached, they're going in the book. Anybody that's ever been on any of my lives or have sent me really positive things about them passing the NCLEX, they're already in the book. I actually sent that last bit of stuff off today. So going forward today, no one else, if your name's on there, you're not going to, I mean, if you tell me you pass NCLEX, you're not going to be in the book. But the whole point is to show that one person can help change the trajectory of someone else who thinks that they can't accomplish this goal. That's what it's about. I want everybody to succeed. I want everybody to eat, even if it's not at my table. I want you all to eat. And that's what it's about too. Getting that license, going out here, being a servant of the people, you know, getting that knowledge, taking care of them, and of course, always taking care of you. So with that, ladies and gentlemen, I am going to call it a night. Of course, check out everything I got going on, bootnurse.com. Check those links in my bio. Make sure you guys, of course, follow me so you guys know when I'm going live. 7-day NCLEX course is going to be on and popping this coming week, right? So we're going to be going live in there, and I'm actually going to be bringing people in there. So make sure you guys check that out as well. And then lastly, of course, be great to yourself. You only got one you. You only have one you. Take care of yourself. You know, have a good support system. Take care of them. All of that. So if you can't take care of them, you can't take care of nobody else. But with that being said, ladies and gentlemen, I hope everybody has a really great weekend, a safe weekend, and I will see everybody on Monday.